A very good morning to all. Hope you have finished learning neuroanatomy. And so now we are continuing with the topics remaining in head and neck. And so in this session, we'll be dealing with pharynx. So what is actually this pharynx? This pharynx is actually a fibromuscular tube which acts as a common passage for air and food. Okay, so this pharynx will be actually extending from the base of the skull to the lower border of cricoid cartilage, where it becomes continuous with esophagus, and you find it is approximately 12 to 14 centimeter in length. So what you see here, this is the pharynx. So this pharynx has got three parts. That part which lies behind the nasal cavity, this is the nasal cavity, and that part which lies behind the nasal cavity is what is termed as nasopharynx. This is the oral cavity, and that part which lies behind the oral cavity, that is the oropharynx, and this is the larynx. So that part of the pharynx which lies behind the nasal cavity, behind the larynx, that is what is termed as laryngopharynx. So oropharynx, nasopharynx and laryngopharynx are the three parts of pharynx. So read that. It forms the upper part of air and food passages. It is extending from the base of the skull to the lower border of cricoid cartilage, where it becomes continuous with esophagus. And always remember, this lower border of cricoid cartilage is corresponding to C6 vertebra. That's very important. Lower border of cricoid cartilage is corresponding to C6 vertebra, and it is 12 to 14 centimeter in length. So now you should be familiar with the external relations of the pharynx. So shall we look at the external relations? So what are they? This is the region that is termed as the roof of the pharynx. So roof of the pharynx is actually formed by the body of the sphenoid plus a part or the basilar part of the occipital bone. So this is the roof which is formed by the body of the sphenoid and the basilar part of occipital bone, and below it is continuous with the esophagus at the level of lower border of cricoid cartilage, corresponding to which vertebra posteriorly? It is the C6 vertebra. So superiorly you know the relation, inferiorly with esophagus at the lower border of cricoid cartilage corresponding to C6 vertebra. So what is this relation anteriorly? Anteriorly you find the pharynx is characterized by many deficiencies. So look at that. In the upper part, this nasal cavity is actually communicating with the nasopharynx through that deficiency there. That is what is termed as posterior nasal aperture, or in short, nasal cavity is communicating with the nasopharynx. Oral cavity is communicating with the oropharynx, and the larynx through the laryngeal inlet is communicating with the laryngopharynx, or in short, you find this anterior wall is characterized by three deficiencies through which pharynx will communicate with the nasal cavity, oral cavity, and then larynx. Fine. So what is the relation you find posteriorly, this posterior relation? It is formed by the first upper 6 cervical vertebra with the intervertebral disc. So read that. What is the external relation? Above you find the body of the sphenoid and the basilar part of the occipital bone, and below it is communicating with the esophagus at C6 level, and anteriorly you find the anterior wall is deficient at three places through which pharynx will communicate with the nasal cavity, oral cavity, and larynx. And behind you find the upper 6 cervical vertebra with the intervertebral disc. That much is clear to you? Okay. So look at that. That is the deficiencies in the anterior wall through which The pharynx is opening into nasal cavity, oral cavity, and larynx. So now we come to the subdivisions of the pharynx. You already know the subdivisions. Name them. 1 is nasopharynx, 2 oropharynx, and 3 laryngopharynx. So which pharynx now I am touching? That is the nasopharynx. Which pharynx I am now touching? That is the oropharynx. And this is the laryngopharynx. Okay. So I told you the pharynx acts as a common passage for air as well as food. So the air will enter through the anterior nace. It reaches the nasal cavity, then passes through the nasopharynx and then the oropharynx. Then it enters the laryngopharynx, and in the anterior wall of the laryngopharynx you have got the laryngeal inlet through which air enters the larynx. Okay. And what about food? From the mouth it appears the oral cavity, then the oropharynx, and then the laryngopharynx, and from the laryngopharynx it enters or passes down to the esophagus. So nasopharynx is exclusively respiratory in function, but the other two, the oropharynx and the upper part of the laryngopharynx, of course, and oropharynx and the laryngopharynx will help for the passage of air as well as food. So with that we finish the introduction to pharynx, and now we are going to discuss pharynx under 2 parts. In the first session we are going to deal with the layers of pharynx. In the second session we will be going through the interior of pharynx. So that is how we are going to proceed. So first we will start with the layers of pharynx. So imagine any wall of the GIT will be having different layers. Just like that, pharynx has also got these layers. So I am talking about the layers from inside to outside. Fine. From within outwards. So what are the layers? The innermost layer, of course, you know, that is the mucosa. And outer to the mucosa, you find the next layer. And what do you call that layer? That is the submucosa. And outer to the submucosa, you find a fascia, and that is what is termed as the Pharyngobasilar fascia. Fine. So mucosa, submucosa, the Pharyngobasilar fascia, and outer to that you find the muscle coat coming. There is something very peculiar to the muscle coat. The muscle coat here is arranged as inner longitudinal and outer circular. The outer circular is what is termed as outer constrictors. Okay. So the muscle coat is arranged as inner longitudinal and outer constrictors, and still outer to the muscle coat you find the last covering of the pharynx, that fascia, and that is what is termed as the buccopharyngeal fascia. So is it clear? So you find mucosa, submucosa, Pharyngobasilar fascia, the muscle coat characterized by inner longitudinal outer constrictors, and finally you get the buccopharyngeal fascia. So now we are starting with the mucosa. So it's very easy to remember the mucosa. Think of the lining epithelium. Always remember the oropharynx and the laryngopharynx will be lined by stratified squamous non-keratinized epithelium. But the nasopharynx will be lined exclusively by the respiratory epithelium. What is respiratory epithelium? It is pseudo-stratified ciliated columnar epithelium. So it's very easy. How you remember? Nasopharynx, you have got the respiratory epithelium. What is it? It is the pseudo-stratified ciliated columnar epithelium. And the oropharynx and the laryngopharynx is characterized by the stratified squamous non-keratinized epithelium. Do you know why this difference is there? That is because the food is actually passing through the oropharynx and the laryngopharynx and then to the esophagus. So this oropharynx and the laryngopharynx will have to accommodate some friction. For that you get such an epithelium there. But the nasopharynx is exclusively respiratory in function. So it is adapted to having such an epithelium. Is that clear? Okay. So now we finished mucosa, and now we are proceeding on towards the next part, submucosa. So submucosa is characterized by a lymphatic aggregation, and what you call that lymphatic aggregation is a mucosal associated lymphatic aggregation which you find at the entry of the oral as well as the nasal passages, and these lymphoid aggregations are collectively termed as what? Waldeyers ring. So what is Waldeyers ring? It is actually a lymphoid accumulation you find in the submucosa of the pharynx, where actually it is at the starting of the oral as well as the respiratory passage. So some more details about this Waldeyers ring which you find in the submucosa you should be familiar with. Shall we proceed? Okay. So look at that, that is the Waldeyers ring. So this is a section. So these four together forms the Waldeyers ring. So this is the nasopharyngeal tonsil. Okay, and on either side you find the next tonsil, that is the tubal tonsil. Then you find the next tonsil here, that is the palatine tonsil, and very close to the posterior third of the tongue you find the next tonsil, and that is the lingual tonsil. So first is the nasopharyngeal tonsil, that is you find at the nasopharynx. Then you find the tubal tonsil, that too in the nasopharynx. Then you find the palatine tonsil, that is in the oropharynx. And finally the lingual tonsil, and that is in the posterior third of the tongue. So at the entry of the oral and respiratory passages in the pharynx you find a circle of lymphoid accumulation, and that is what is termed as Waldeyers ring. Name the four counterparts of Waldeyers ring. 1. Nasopharyngeal tonsil. 2. Tubal tonsil. 3. Palatine tonsil, and finally 4. Lingual tonsil. So look at that, it is marked as adenoids there. Why is it so? That is, this nasopharyngeal tonsil after the age of 6, if it enlarges, it can lead to respiratory difficulty in children, and such an enlarged nasopharyngeal tonsil, that is what is termed as adenoid. So with that we finished mucosa, submucosa, and now we are proceeding on towards the next layer, Pharyngobasilar fascia. So this Pharyngobasilar fascia is present throughout, but remember it is very much thick at the upper part. To be more specific, in the gap between the base of the skull and the upper margin of superior constrictor. At that region, you find this Pharyngobasilar fascia will be very much thick. In all other areas, it will be present but very much thick. So now we have finished the next layer, and now we are proceeding on towards the muscular coat. So do you remember the pattern that I mentioned before? What was the pattern? It is inner longitudinal and outer constrictors. So read the names of the inner longitudinal. It is stylopharyngeus, palatopharyngeus, and finally salpingopharyngeus. So these are the three longitudinal muscles. One is stylopharyngeus, 2 palatopharyngeus, and 3 salpingopharyngeus. What about the constrictors? 3 constrictors. They are superior constrictor, middle constrictor, and inferior constrictor. So now we are going to start with the muscles of the pharynx. So muscles of pharynx, we are first starting with the circular muscles or constrictors. Name them: superior constrictor, middle constrictor, and inferior constrictor. So there is something specific to the orientation or the positioning of these constrictors. What are they? Imagine 3 pods kept one inside the other. So you have kept a lowermost pod there, and imagine that as the inferior constrictor. On top of it, you keep the next pod. Imagine that to be the middle constrictor. And so you're keeping that middle pod in such a way that the lower border of that middle constrictor will be overlapped outside by the inferior constrictor. Fine. And on the middle constrictor, you are keeping the next pod, that is a superior constrictor. So what happens? The lower border of the superior constrictor will be overlapped by the upper border of middle constrictor. Fine. So that is the orientation you get in the muscles of the pharynx. To be more specific, the constrictors of pharynx. So look at that. You have 3 constrictors. This is the superior constrictor. This is the middle constrictor, and finally below you get the inferior constrictor. So now we are going to discuss the first constrictor, that is the superior constrictor. Sorry. So first we are starting with the superior constrictor. So look at that, that is the superior constrictor. This superior constrictor, I told you, is the upper part, or this is the most superiorly lying of the three constrictors. And what is so specific about the superior constrictor is it has got a wide origin. Can you say the origin of superior constrictor? It is taking origin from the medial pterygoid lamina here, then from the pterygomandibular raphe, then from the medial end of the mylohyoid line, and then from the side of the tongue. Such an extensive origin you find for superior constrictor. Once more, from the medial pterygoid plate, from the pterygomandibular raphe, from the medial end of the mylohyoid line, and then from the side of the tongue. Are you familiar with the pterygomandibular raphe anywhere else? Where? When we were discussing the buccinator, the origin, you remember that? So, from such a wide origin, you find the superior constrictor muscle is passing sideways and laterally. And once it reaches the posterior part, look at that, that is the posterior view of the pharynx. And you see this muscle, all the constrictors will be finally getting attached to the median fibrous raphe. Fine. So the origin of superior constrictor from which all regions? From the medial pterygoid plate, from the pterygomandibular raphe, from the medial end of the mylohyoid line, and from the side of the tongue. It passes medially, laterally, sideways, and then finally gets inserted to the midline. That is the median fibrous raphe. So this is the origin part anteriorly. After that you are seeing it is going laterally. You are seeing laterally. Once it reaches the posterior part, it is getting inserted to that fibrous raphe. So read that. The origin from the medial pterygoid lamina, pterygomandibular raphe, mylohyoid line of mandible, and from the side of the tongue. And two more things you should remember in addition to the origin and insertion. What is it? One is this superior constrictor is actually forming a part of tonsillar bed. So tonsillar bed means, are you familiar with the palatine tonsil we mentioned in the Waldeyers ring? Okay. So that bed on which this tonsil rests, that is what is termed as tonsillar bed. So one muscle you find there is the superior constrictor muscle. So you can remember, superior constrictor is forming one part of the tonsillar bed. And one more thing is, it is contributing in the formation of Passavant's ridge. So what is this Passavant's ridge? When you hear this Passavant's ridge, it is mainly formed by the palatopharyngeus muscle, one longitudinal muscle that we studied. You remember the three longitudinal muscles of pharynx? One was palatopharyngeus. So this palatopharyngeus muscle, along with the superior constrictor, some fibers of the superior constrictor, is forming a ridge termed as the Passavant's ridge. So this is your palatopharyngeus. This is the soft palate. What you see here is a soft palate, and this muscle coming down, that is the palatopharyngeus. This palatopharyngeus along with superior constrictor forms the Passavant's ridge. So what is the purpose of such a ridge there? You must be thinking, what is this Passavant's ridge? So some more details about the Passavant's ridge you should be able to say. What is it? Look at that section. What is this? This is the nasal cavity. This is the nasopharynx. This is the oral cavity. This is the oropharynx. This is the soft palate. So what happens? The food is entering from the oral cavity, then it is entering the oropharynx, then it should go down towards the laryngopharynx. So when you are swallowing, there is every chance that the food can go up into the nasopharynx. So that should be prevented by the approximation of this soft palate towards the posterior pharyngeal wall. And one counterpart you find there in the posterior pharyngeal and the lateral wall. And that ridge is what is termed as Passavant's ridge. So during swallowing, what happens? This soft palate will be very closely approximated to the posterior pharyngeal wall via this Passavant's ridge. And thereby the return or the reflux of food to the nasopharynx will be prevented. Fine. So with that, we finish the superior constrictor. So the origin, you can remember the insertion plus the formation of tonsillar bed plus the Passavant ridge. Remember, the Passavant ridge is mainly contributed by which muscle? It is the palatopharyngeus with contribution from the superior constrictor. The main is palatopharyngeus. Fine. So now we have finished the superior constrictor, and then we come to the next one, middle constrictor. So look at that figure. In the figure, you are seeing a bone here. Which is that bone? That is the hyoid bone. So in dissection, it is very easy to identify the middle constrictor. All these muscles behind will be continuous in the posterior aspect. So how you identify the middle constrictor is, you look for the fibers specifically coming from the hyoid bone, going laterally and then behind. So that will be your middle constrictor. So where is the origin of the middle constrictor? It takes origin from the lower part of the stylohyoid ligament. This is the stylohyoid ligament, and there you find the lesser cone of the hyoid bone, and in the upper part of the greater cone of the hyoid bone. From these three regions, you find the middle constrictor is taking origin, then passing laterally, look at that, laterally, and then getting inserted into the median fibrous raphe. So read that. The origin is from the stylohyoid ligament, from the lesser cone of the upper border of the from the lesser cona and from the upper border of the greater cone of the hyoid bone, and passing laterally and finally getting inserted to the median fibrous raphe. And one more thing that you should remember here is, when you're discussing the anterior triangle, you were taught about the carotid triangle. Remembering that? At that region, we said one part of the floor of the carotid triangle is formed by middle constrictor. Are you remembering that? Okay. So this much details of the middle constrictor you can remember. So now we are starting with the next one, inferior constrictor. So I think I'll stop here in this session, and in the next part, we'll continue with the inferior constrictor and other longitudinal muscles. Okay? So I'll stop here. Okay, thank you.